Post-weaning colibacillosis in swine. What is colibacillosis, you ask? Escherichia coli, a coliform bacteria, is one of the most important causes of post-weaning diarrhea in swine that occur 3 to 10 days after weaning. E. coli are gram-negative bacteria that affect many body systems. Facts. This diarrhea is responsible for economic losses due to mortality, decreased growth rate, and the cost of medication. Escherichia coli is a major part of the commensal intestinal microflora of swine, but some strains can cause disease. The anterior small intestine is the main focus of the infection and is the site of underlying fluid and electrolyte loss into the intestinal lumen. Clinical signs. Colibacillosis is usually signaled by the appearance of diarrhea. Piglets from gilts may be more severely affected than piglets nursing sows. It may be clear and watery, especially in neonates, but may be white or yellow, influenced by the type of ingesta and duration of the disease. There's roughened hair coat, weight loss, and metabolic acidosis, vomit. Most strains of E. coli are harmless, but those that cause diarrhea after weaning are often distinguished by their capacity to lyse red blood cells and are known as beta hemolytic E. coli. The diagnosis. The isolation of uniform and high population of smooth, mucoic or hemolytic E. coli from the small intestine is suggestive. Diagnostics labs often use one of the following methods to more specifically identify the pathogenic E. coli. A slide, agglutination test can identify the serogroup but does not confirm pathogenicity. Adhesins can be identified using monoclonal antibodies. A polymerase chain reaction can identify the pathogen genetically. As E. coli are commonly found in the small intestine of both normal and diseased pigs, microscopic examination of small intestinal sections can be useful in distinguishing the significance of the infection. Dense colonization of the brush border with adherent E. coli should be expected in most cases of colibacillosis, with additional erosive or congestive changes present depending on the toxins that have been elaborated. Prevention and treatment. After weaning, pigs need to be fed a diet that creates conditions in the gastrointestinal tract that stabilize the dynamic balance between the various components of the gut ecosystem, predominantly the mucosa and the microflora. If this diet is successful, it will minimize the disturbance of the structure and function of the gut and reduce the likelihood of enteric bacterial diseases such as post-weaning colibacillosis. Dr. D.E. McDonald stated in his article that PWC can be induced experimentally by inoculating pigs with the strain of E. coli after weaning. He also observed that when CMC, a viscous unfermentable polysaccharide, was added to a protective diet based on cooked white rice and animal proteins, PWC did occur. The use of oral or systematic antibodies together with electrolyte replacement therapy is the most common method used to treat PWC. Apomycin is an oral and an injectable preparation. Antibiotic compositions comprising tylosin and apomycin are effective in the treatment and control of colibacillosis in weaning pigs and demonstrate greater effectiveness than apomycin alone or tylosin alone.